Hi friends, myself Dr. Maddineni, Srinivas, certified dermatologist from India, discussing derma related topics. So this is today's MCQ. Young girl having low intelligence presented as shown below, and there is some history of epilepsy mentioned in the MCQ. And by looking at these lesions and the history of epilepsy, low IQ, and these lesions are Adenoma Sebaceum. That is, the patient is having EpiLoiA, and these are the features of Vogts Triad, Vogts Triad, and it is seen positive in TS, that is tuberous sclerosis. So the answer here is option B. So EpiLoiA, epilepsy, EPI, and low intelligence, LOI, and yes, A is Adenoma Sebaceum, the lesions which are mentioned in this image. So almost all the students have marked it right. Very good, friends. So few points about this condition, tuberous sclerosis. It is autosomal dominantly inherited disorder where the mutations are going to be two types. That is, it could be either in the hamartin or it could be in the tuberin, both of which are tumor suppressor genes. So cutaneous findings which are very important are Adenoma Sebaceum, which are also called as facial angiofibromas, and there can be hypopigmented lesions like, for example, Ash Leaf Macules. Confetti pattern can also be seen, and shagreen patch can also be noted, and periangual fibromas, Koenens tumors can also be noted periangually, and cephalomacules can also be seen apart from neurofibromatosis. And this is the diagnostic criteria for tuberous sclerosis complex, and you can see major features and minor features are mentioned here. To definitively diagnose this condition, either two major features or one major feature and two minor features are necessary. So among which more than or equal to 3 angiofibromas, which are nothing but the Adenoma Sebaceum, more than or equal to 3 hypomelanotic macules, that is Ash Leaf Macules, more than or equal to 2 ungual fibromas, that is Koenens tumors, shagreen patches, multiple retinal hematomas, cortical dysplasia, subependymal nodules, subependymal giant cell astrocytoma, SCGS, SEGA, cardiac rhabdomyoma. These are the important ones which I am highlighting. And in the minor features, remember, more than or equal to 3 dental enamel pits, more than or equal to 2 intraoral fibromas or confetti-like skin lesions. These are the ones which were previously tested, and these are important for you to remember. I hope this kind of short, sweet, revision videos are helpful. If so, please do hit that like button.